What is the most dangerous plastic surgery procedure? This is a common question I'm asked, and the answer would be a BBL. That stands for Brazilian butt lift. So that is when people take fat, typically from the abdomen, the flanks, sometimes the back and the thighs, and re-inject it into the buttock. So people do this because they want a more contoured silhouette. So they will contour the waist so it's slimmer and then have a larger, rounder, fuller buttock. The reason the mortality rate is so high is threefold. Number one, there are a ton of large veins in the buttock. So when you're injecting fat, it's really easy for the fat to enter these veins. These large veins then go to the heart, brain, lungs, and they can cause immediate death if fat is injected directly into those vessels. The second reason being, when the death rate was really high, which was around 1 in 6,000 procedures, a lot of non-board certified plastic surgeons were performing these procedures. So these are often cosmetic surgeons or people who claim to be plastic surgeons but aren't actually trained. So they were performing this procedure and not understanding where the anatomy was, causing a significant death rate. Since this has been discovered, there has been a big push by ASPS, or the American Society of Plastic Surgeons, to really monitor who is doing these procedures. The death rate went down from 1 in 6,000 to about 1 in 15,000 now. The third reason would be understanding the cannula size using when injecting fat. So a small cannula, even though you would think that is more safe, actually is sharper and can puncture into the vessels more easily than a large fat cannula. So people often mistake using a small cannula because they want to be less traumatic, but in fact that increases your risk of injecting fat into large veins. So if you're interested in pursuing this procedure and having a BBL, make sure you see a board certified plastic surgery who has done a lot of these procedures.